Okay, sugar. We love our sugar. There is a correlation with acne. It can cause that dullness, and I'll go into that in a second. Fine lines and wrinkles accelerated, and it can thin the skin as well. So what happens is sugar molecules actually attach to collagen, and it disrupts these fibers. It makes them less flexible and more rigid. This is called AGEs, or advanced glycation end products, appropriately named, I think, because it's really causing that acceleration of aging within that collagen structure. So we also know that uncontrolled blood sugar is quite damaging to cells generally, but it also increases insulin, which then leads to increase in our stress hormone cortisol. And cortisol can be quite hard on our tissue as well. So it's always important to kind of calculate how much sugar. I hear this all the time, like, oh, I don't have that much sugar, and it's like, well, it hides in a lot of things. I did a quick calculation for a 16-ounce non-fat Starbucks latte, no sugar added. You're getting about 4.5 teaspoons of white sugar just from that. That's before even adding any sweetener. Another place that sugar hides is in yogurt. So a lot of people think yogurt's healthy for them, and it can be, but if you're getting flavored yogurt in those little personal size that usually we send off with kids to school, they're up to 6 teaspoons of sugar in that, and that's white sugar per serving. So definitely can hide in a lot of places. So always really good to really evaluate or get someone like a naturopath to evaluate your sugar consumption, because we'll probably have a different opinion. And then,
so can I ask, how do you get the sugar in a latte if you don't put sugar in it?
well, you're getting it from the dairy itself.
Just from the dairy?
Yeah, there's a bit of lactose in that too. So, and if you're getting like the non-dairy, like the coconut alternatives, there's quite a bit of sugar in those too. So that's without adding your own sugar to it. Yeah. So alcohol is another, I guess it's not a food, but another, I guess, part of our lives that can influence the skin. We see fine lines accelerated, more droopy, especially in the eyelids, crow's feet, lines around the mouth as well, enlarged pores, redness, puffiness, and it can accelerate certain chronic skin conditions as well. So how does it do this? Well, we know it does increase oxidative stress on the body and on cells, so we learned about how that influences the DNA. It also causes dehydration, which we know is bad for the skin. It can be high in sugar, depending on your alcohol of choice. And what it also does is it increases capillaries to come to the surface. So that causes that redness that happens when some people drink. But what happens if you're drinking quite a bit and this is happening a lot, those capillaries stay there and you tend to have that redness all the time, regardless if you're drinking or not, especially around the nose or on the cheek area. And I put up the Canada guideline for alcohol consumption, so no more than 10 drinks in a week for women and no more than 2 drinks at a time. I always like to recommend, at least if it's a sort of a social habit for you, to at least take 3 weeks off a year, maybe every 6 months, just to give your body a break anyways. It's a good kind of guideline to make sure you're falling definitely within the Canadian guidelines, and then maybe looking at drinking habits over a month as well. So we know that sun can be quite damaging and UV radiation on our skin. We kind of call this photoaging, when someone spends too much time in the tanning bed or in the sun itself. It does increase as we age, our melanocytes, so that's what's producing the pigmentation that helps protect us. They start to decline as we age, so we actually become more susceptible to UV damage, and chronic exposure does damage connective tissues and alters our skin metabolism as well. So we know that a little bit of sun exposure is healthy, because as we know, we need that vitamin D, but it's suggested that maybe 10 minutes between that 10 a.m. to 2 p.m. time is a good time to be out there to get that vitamin D production, but you only need about 10 minutes in the sun, so that's something to keep in mind. Now there's 2 different types of radiation. So UVA, these are longer waves and they go deeper into the skin. That's what kind of causes that pigmentation and more spots and hyperpigmentation. You can think of this as like the suntan, like what causes our suntans, but it also can lead to sun damage. So think about burnt toast. That's leading to, when you're getting burnt, that is causing cellular damage and increasing oxidative stress. Then we have UVB rays. They're medium wavelength, and they're also quite damaging to our DNA. But these are the rays that are important for that vitamin D production. So we do want a little bit of them, but just not a lot, because that's the one that leads to non-malignant skin cancers and things like that. So smoking. So beyond its known links to cancer, lung disease, cardiovascular disease, smoking is associated with premature skin aging as well. And we know through studies that it can actually accelerate premature aging faster than sun exposure. So it obviously leads to fine lines and wrinkles, especially like the smoker's line above the lips, crow's feet, that kind of thing, delayed healing. And it also reduces our ability to have that nice type 3 collagen production. So what is it doing in your body? Aside from the free radical damage that is happening from the smoke itself, the smoking increases our need for vitamin C, and vitamin C is really important for healthy collagen production. It also leads to narrowing of blood vessels, so we're not getting as much blood supplied to the skin, and it depletes our body of other important nutrients like vitamin A, zinc, all of those really important antioxidants. So we know that it is quite hard on the body. And actually there was a stat that someone who smoked 30 cigarettes a day by the age of 70 has aged about 15 years more than what they were. So we know that that is something that accelerates aging. And stress. Of course, that's a big one. So your emotions have a very powerful effect on your whole body, and this doesn't exclude your skin. We have a lot of nerve endings within our connective tissue, and when you're really tense, your body releases our stress hormone cortisol, and this actually leads to this increased oil production. So if you're prone to acne, acne can flare up. It also causes lots of inflammation, so eczema, psoriasis, all those types of skin conditions tend to flare up as well. So when we know that cortisol is there for helping us in stressful situations. Now, back in the day, it was running away from that bear or dinosaur or whatever it was, but now our body doesn't know the difference between just general life stressors and that bear that's chasing us. So the physiology is exactly the same. And what happens is the cortisol shunts blood away from non-essential tissue like our skin so that we can, get our legs moving and get our heart racing to run away. So what happens is there's less blood flow to that area, less nutrients getting carried, and that can lead to that dull complexion. We also see that cells don't turn over as fast, so we get that kind of washed out look. Among all the other digestive issues, so not getting enough nutrients in those situations as well. Stress is a whole topic on itself we'll probably do in the near future because it's so prevalent, and there's so many things that we can do to help. And sleep. Now, obviously, sleep is a cornerstone to health generally, and getting a good quality every night's sleep won't erase wrinkles magically, but it definitely can slow down the aging process. While you sleep, your body actually makes new collagen, and this keeps the skin really strong and elastic. The deeper stages of sleep are when our body produces the most growth hormone. So that's really important for having youthful appearance, having more energy during the day, and just our body's way to heal itself, I guess, throughout the night. It also you also rehydrate when you sleep, and this brings more oxygen to your cells, and it makes the fine lines and wrinkles less visible. We've all woken up after not getting enough sleep and being like, oh man, just like puffy eyes and wanting to wear sunglasses because you know that you can just tell on some people's faces that they haven't had enough sleep. And we do know that when we're stressed, cortisol and melatonin are inversely related, so cortisol levels go down at night, and so that's another time to help re-establish the balance. So obviously we want to try and get around 6 to 9 hours a night if we can, and that has been shown to reduce general inflammatory risk overall. And the more time you can get to sleep before midnight, it actually counts for an extra hour. So it's just getting a little bit more rejuvenation that way. And then hormonal factors. So we kind of learned already that hormones do play a role on the skin themselves, from anything from insulin, cortisol, and then the sex hormones as well, not just in menopause when they start to decline, but also obviously in puberty years we see those fluctuations happening, and into adulthood as well, leading to issues with our skin. So in perimenopause specifically, we see that decline happen, and that's leading to dryness, thinning, fine lines and wrinkles showing up faster than we'd love for them to happen, and just reducing that overall cell turnover. So obviously at any age it's really important to make sure your hormones are balanced. So let's go over a few of the more inflammatory skin conditions that are quite common. So eczema, or also known as atopic dermatitis, it's an inflammatory skin condition. If you've ever had it, you know it's like patches. They're usually itchy, they're usually worse at night. They can be really dry, or they actually can be oozing as well. Usually aggravated by stress, environmental factors, and we do see a pretty big correlation with dietary factors as well. So a big way to treat it is removing that trigger and identifying what it is for that individual. Some supplements to consider. So fish oils are amazing at reducing inflammation. It does take a couple of weeks for that to sort of set in, so it is something you want to be on a more regular basis. As I've mentioned, vitamin C is so important for that collagen production. So is vitamin A, E, and zinc, so really helpful for healing that tissue. And there are some topical considerations. Now obviously when we're looking at the skin, it is that window to the internal environment, so we want to look inside the body for the ultimate healing, but we also want to treat that irritation and aggravation. So these are some herbs that work really, really well, and we do sell a really amazing line at the back that is therapeutic doses of these herbs for helping palliate those symptoms.